We will call our meeting to order. We do have a quorum at this time, and I will do the invocation. Heavenly Father, we thank you for this organization, God, and we thank you for the protection that you have provided for us through this COVID situation. We ask that you continue to guide us and give us wisdom as we go through our meetings and making decisions for this county. Amen. Okay. Our first item would be to adopt the agenda for today's meeting. So may I have a motion to adopt the agenda? And I don't have to call your names individually this time.
So moved. Second.
Okay. All in favor? Thank you very much. And also, our next agenda item would be to approve the minutes from our last meeting, which we do have the regular meeting minutes as well as the closed session minutes. May I get a motion to approve those minutes from our last meeting for March 9th?
Move to approve.
Thank you. That was Mr. Kincaid. May I get a second?
Second.
Okay, that was Mr. Dr. Bothwell. Thank you very much. I guess I'm happy to do it. Okay. And at this point in time, we'll start our reports, and Sue Yates is up.
Erin, will you go to the next? So I'm bringing to you the 3 reports that summarize where we are financially. This is a summary report, so you can have a snapshot of where the budgets are. Dental has moved from red to yellow as we are continuing to monitor it. The revenues and expenses are coming into line a little bit more. Have additional dentist is on board. The financial report, the one right before that, this shows where we would be year to date if we closed our fiscal year at the end of March. We look a little bit better each month as COVID revenues come in, as well as some of our grants are releasing some of their indirect dollars that we know we're going to get now. So that is this particular report. And then the last report shows actuals last year versus this year and where we are, and some of the biggest differences are due to COVID or the sale of the NCTN project. Is there any questions? Okay.
All right, thank you very much. And you get done. We have our presenters in the holding room, so we'll kick.
We're one at a time.
Good evening, Dr. Cabarrus. You could share your reports as far as employee separations.
So the total for the third quarter is 10 separations. The rate is 4.22%. As you can see, we had a high month in March at 5 and a low month in March and February of 2 separations. And again, we don't count retirements, people who move out of state, things like that. So these are pure separations. Since anybody have any questions?
Any concerns about filling those positions back?
Some of those positions are hard to fill, particularly dental assistants. So that would be where we have some concern about. I think we'll be able to get it done fairly quickly, but those are typically harder to fill positions.
Any other questions?
Any questions? All right. Thank you.
We'll see you back shortly.
All right.
Okay, Eric, you're up next.
All right, well, good evening. It's good to see everybody in person tonight versus. I'm going to give a very condensed update for COVID. Wish I had a bit better news for you tonight, but hopefully by sharing our concern, we can collectively make a difference to turn our trends back the other way. We don't usually look at this slide together but I wanted you to see some trends we're seeing. We have the 1,000 mark in terms of total number of cases. I'm showing you here the percent positive. You can see we did get down to 4.8% positive in March, but we've slowly crept back up. So we are sitting at 6.4%. Good evening. 247 deaths. What I'm most concerned about at this point in time is the number of hospitalizations has really skyrocketed. So we are at 28 Cabarrus residents hospitalized and a total number of hospitalizations in Cabarrus County at 62. So I'm concerned about that. A bit of good news is our total active number of cases is down from last week at 779, though we do have a handful of cases in long-term care, and those are always concerning when we have cases back in our long-term care facilities. Just quickly, you can see graphically, we declined pretty rapidly there, and we're seeing not as sharp of an increase, but we are seeing a steady increase there. Hopefully we'll plateau it again, going back downwards here soon. Percent positive, you can see that graphically. We like to keep that at 5 or below. I'd like to talk to you for just a minute about vaccine clinics. It feels like vaccines are really kind of ruling our lives right now. Big thanks to all of you who have been able to volunteer at a clinic, provide snacks and beverages, and make referrals to us. So we're keeping this document as a running list of all the clinics that we've held this week. Yesterday, we actually had a second dose clinic in this room. On Thursday, we will have an El Puente clinic. That is a clinic that is targeting our Hispanic population and is very popular. They usually have a waiting list 2 clinics in advance weekly. So we're looking at ways to expand that clinic. And then on Friday, we're going to try something new. We're going to have our traditional clinic at the Cabarrus Arena, and then we're also going to have a clinic at Barber Scotia College. And we're hoping that Barber Scotia is going to become a consistent clinic as well as we scale back from the arena and we'll keep Barber Scotia. And then Saturday, we'll be at the arena for second doses. Can't say enough about our partners at the arena. Have just been the best to work with, and all the volunteers who have been out. Could not do this work without them. This is from the Department of Health and Human Services website. In Cabarrus County, 25% of our population has been at least partially vaccinated. So that means if they got Moderna or Pfizer, they got at least 1 of the 2 shots already. So that's good. And 17.4% is fully vaccinated. Those are a little bit low because those take into account individuals who are ages 0 to 15. So they're not eligible for any vaccine right now. But we're pleased to see that 25%, and we want to work together to continue to get that number up. Any questions about COVID at this point in time? Welcome.
So how's our supply of vaccine? I mean, we're still delivering all we can get, right?
Yeah, so right now, we had multiple calls today about that. So right now, the demand is still outpacing the supply. However, we are seeing that differential, really that gap closing to where it would take us about 40 minutes to fill a 1,100 person clinic weeks ago. Last week, it took us about 24 hours. So when we open this Friday's clinic tomorrow, it's going to be very interesting to see how long that takes to fill, especially on the heels of the Johnson & Johnson news today. Even though we are going to be providing Pfizer on Friday, we still feel like there's going to be some public hesitancy for all of the vaccines, not just the Johnson & Johnson. So, but we are starting to see that supply and demand differential gap close. But right now, we're still good. Excited to welcome Cannon Pharmacy on as an approved vendor. Now they got 1,500 doses this week, so we're excited to share the vaccine work. We welcome anyone else who would like to join in that with us. So each week we have new providers coming on board.
Are we doing equally well in our Black and Hispanic and Asian communities?
So in our Asian community, yes. So there is no disproportionate percentages there. In our Black and our Hispanic community, there's still about a 6% gap that we're working to close. So that's why the El Puente Clinic is so important, and the Barber Scotia Clinic we hope is going to help as well. And so that's why El Puente started, the first week was 30 individuals, and the next week was 60, and then it kept growing, and we hope that that will happen with our Barber Scotia site as well. So, but we know that be to a point where we're really going to have to increase the education around vaccines, boots on the ground, getting into neighborhoods, those sorts of things. So we met today with Atrium to talk about, what are our collective strategies as the two main vaccine providers in Cabarrus County.
Pardon me for not remembering messages. Are we working with the churches?
Absolutely. So what's awesome about the Barber Scotia then is actually Reverend Donald Anthony is the one spearheading that. So he and about 10 volunteers canvassed the neighborhoods in a 3-mile perimeter around the college and went door to door, knocking on doors, handing out flyers. And then what we did is we took the calls to get those folks scheduled, and then we'll be out there providing the vaccine. So it's been a really a good partnership.
Aaron was on topic as far as variances. Have we seen any of that in our county?
And I'll talk a little bit about
About the variants that are out there as well?
The latest I heard from the state was that the majority of the strains circulating now in North Carolina are one of the variants. And so they're keeping an eye on that, but it is becoming much more common in the U.S. that the UK variant is becoming the most predominant one. I was also going to ask Dr. Hans and Dr. Hager, they stepped out of the room, and I was chatting with some of the volunteers on Saturday or Friday, one of the clinics they run together. They were saying they're definitely noticing a lot more like ER visits and that for COVID or COVID-like symptoms, and just checking on the strain, how the hospital is responding.
Dan can tell you more about that. We are seeing an increase in COVID positive patients and ER. We can probably give better numbers out here.
We certainly need everybody to continue to be vigilant in using those 3 W's, even once you have the vaccine.
Any other questions on the COVID update? Okay, we'll turn it over to Dr. Cohort.
Good evening, everyone. Just to go through my report, again, you have a copy of it. I'll just highlight some of the most notable issues in each of them. Our human resources under the direction of Dr. Cathcart has really been accomplishing quite a bit. We have completed our salary study as of April, will be complete as of April 15th. And so we'll likely be coming to you over the next month or two with some of the recommendations about what has to happen there for equity type purposes. They have also implemented a new hiring process that is engaging HR much more frequently in the process to free up, be more focused on the managing of their programs. In our finance world, we have submitted one grant during February for $420,000 for our positive parenting program, and are working on a couple of grant opportunities throughout. IT has been instrumental in our whole COVID response and getting our epidemiologists up and running. They've helped us get new software up and running here, Tableau and GIS, which will help our epidemiologists and our data folks to be tracking trends and really making sure we're moving to the public health 3.0 model that I've talked with all of you about. In our clinical services, dental is working, our dental director, Dr. Ellie Steele, is working with the NC Dental Board to be able to use hygiene in a more independent fashion. The state has said now that hygiene can work without being under the direct physical presence of a dentist, and that will really help us expand our program in the schools to be able to do much more hygiene work freely in the schools and out in community settings, because we don't have to have a dentist there also while the hygiene folks are doing their work. So we're real excited about that and think that's really going to open up our ability to help more children. You're all probably aware that Medicaid transformation is going to kick in on July 1st after several years of stalling. And open enrollment began March 15th, so this is definitely moving forward. The state said COVID will not stop this. We are going to be transitioning as of July 1st, so we are moving forward with that. In our school health program, in an effort to move towards a more public health 3.0 and population health focus, some of the school nurses have begun working with staff at the schools to get gardens up and running at schools so that we can deal with the issues of healthy living and the increased issues with childhood obesity and poor nutrition. And two nurses that I really want to highlight are Brea Johnson, who you remember won the School Nurse of the Year award not too long ago, and Dallas Picard, who are going to be providing a presentation and training for all of our school nurses on how they were able to effectively get this work up and running with gardens and nutrition education in all the schools. So we're excited about that. And in addition, Wendy Harsh, one of our supervisors, has joined the 5210 initiative that is associated with Children Win and the work that Adrian is doing so that we can get our school nurses more integrated with that, all the public health work, so that we can nursing services in the schools, but really move towards a general, more comprehensive public health services. School nurses have also been, I just couldn't give them enough standing ovations for all that they're doing, because they are instrumental in assuring that we are responding appropriately and well. In addition to all the work they're doing at the schools, they're helping our El Puente clinics that Aaron was just telling you about. And at the schools, in addition to the non-COVID related work, they are helping do the case investigations, partner notifications when students or staff test positive. And they are also offering the rapid antigen testing at the schools so that we can identify cases quickly to isolate a positive case and get them out of the school so that we keep students in school learning instead of ending up potentially having to isolate or quarantine larger numbers of folks in the schools. So they have just been doing phenomenal work in covering both their traditional schoolwork, but also the COVID challenges. In our COVID response, Erin already gave you an update. I just want to point out that she has been spending some time with the other teammates in COVID to say, okay, what does COVID 3.0 look like? In that we've gone from, crisis management, dealing with the, the surging, to what does the next year start to look like? And what is sort of the long-term approach that we're going to use as a health department to keep that well managed? And I think we'll be able to talk to you a little bit more about that next month. Just want to let you know that we're starting to look at that, because now we kind of have to sort of work this into just our normal everyday operations and functions of how this pandemic sort of fits in. In our public health interest, our director resigned in late March. And Aaron and I have been talking about what our best strategy moving forward is, and what the relationship of the CPHI might be with our grants area, and how we can build a robust program around that. And the Cabarrus Brewery selected us as an annual beneficiary for their anniversary celebration, and they raised $2,000 for us that will go into the fund for the CPHI. In our Healthy Living Department, they staff partnered with NC State's Plants for Human Health Institute to get our own rooftop garden up and running. It kind of fell dormant last summer because of COVID and everyone sort of being pulled into that. So I'm excited to see lots of fresh produce growing up there. We're going to start using that in some of our programs to make sure that our most vulnerable folks in the county have access to good, healthy food. And the staff were recently highlighted in the Independent Review for their walking group program efforts. So I put the link in there. I hope all of you had a chance to take a look at that to see the good work they're doing. In environmental health, we've gotten 2 grants recently to improve some of our work there. A food and lodging implementation grant to provide iPads and a language app to our folks so that they can get translator services when needed while they're out in the field. Some of you may not have ever thought about the need for our environmental health staff to have translator services, interpreter services, but in fact, that can be an issue at some of the restaurants, some of the ethnic restaurants and that is needed, and it's already come in handy. We've used it, and we're happy about that. And then we also got an FLI grant from NACCHO for a mentorship program to assure that we are staying in compliance with National Food Regulatory Program standards. For helping Cabarrus, Marcella is going full gear, getting all of our priority community groups together, and we will also be getting the needs assessment report. Will be drafted very soon and off to the graphic designer, and we'll be sharing that with you in the next couple of months as we move from having done the needs assessment into the implementation phase of our work. For our performance and quality improvement efforts, Betty Foe was instrumental in getting some funding from NACCHO for us to serve as a lead agency for a statewide association training program for performance improvement. Just kudos to her for the really excellent work she's doing at getting us really in tip-top shape with data, metrics, outcomes, a very evidence-based approach to all the work we're doing here. We have several more scorecards go live. I hope you get a chance to take a look at them with MDP, and Culinary Innovations, which you'll be hearing about the strategic plan tonight. For Board of Health activities, per our meeting last month, I worked with our legal team to revise our Board of Health bylaws, just cleaning up a little bit of some sort of unclear language. William Eisenhower worked on that himself and brought those back, and we got those out to you last week for you to review so that we can approve them tonight. And then lastly, we have Representative Wayne Sasser visited CHA on March 26th out at the arena for 2 purposes. One, to see our vaccine operations, and then for us to talk to him about the importance of communicable disease funding so that we can always be prepared for pandemics. And joined us, as well as some of the staff, and Mr. Morris was there, and some of the county staff, and I think we had a really productive session with him, and lots of good comments from him, and praise and kudos to the work that's being done. So it's very exciting to have him.
I think he was truly impressed with the operation.
Yeah.
Right.
We actually couldn't find him at first because he just went right out into the talking with the staff and was wandering around visiting with everybody. So yeah. Any questions or comments? All right.
All right. I guess next up will be the Healthy Living Department Strategic Plan. So they're standing by waiting. Coming through the door.
Good evening.
Good evening.
Thanks for letting us join you all. All right, Erin, can I start?
You can start. You just tell me when to advance the slides.
Okay, great. My name is Alicia McDaniel, and I'm the Healthy Living Director, and we'll be going over our plan today. So hopefully you are impressed, and if you have questions, feel free to interrupt us at any point, and we'll try to go through this as quickly as possible for you.
I'm going to introduce your colleagues.
Yeah, if you want to do it now or before they present.
Either way.
Hi, I'm Case Brown. I work with the Minority Diabetes Prevention Program as the program coordinator.
Hello, I'm Anna Tadani. I work with the WIC program.
Awesome, and we're tag teaming this, so you won't just hear one person's voice the whole time. And you can progress the slide. All right, so as a department, in order to kind of build and sustain our collaborative systems, one of the things we want to focus on is making sure we're utilizing the NC Care 360. And so as a department, we will do that for all of our programs by fiscal year 22. So we have a year to put that into place. Next slide. And next slide. In regards to assisting the transformation of our agency, in regards to capacity and culture, we will be incorporating Public Health 3.0 into our department meetings. And I'm proud to say that we were able to do that with a pre and post test in March. And we'll continue those conversations so it becomes part of our everyday language and practice.
All right, this is ready for the slide after that one. All right, so we are in the process of completing the clear text scorecard that Bonnie was talking about, so that all the data that we capture, so all of the things that you see in the action steps are things that we have captured since we started back in 2017, and now that information is going to be out there. So next slide, please. All right, and so we already have a getting to know you form that all of our participants complete, and we're going to include the zip code on that. And with our classes that began in 2020, we have already included that to make sure that we are serving a wide variety of areas in our region. Next slide, please. And so we are, and this is currently in place, so we're currently working with Melissa Velosky, his extraordinaire, with One Charlotte to have a business associate agreement, and so that's still in the draft stages, but they're really our pilot for having a back and forth data relationship, and their hope is that they're going to be able to show their funders that our partnership is very beneficial for both of us. The next slide, please. The next slide, please. And so this is something that we've definitely already done since we started, is that we have always tailored our classes, and we have removed as many barriers as we can. Time constraints, doing makeup sessions for participants where they're not able to attend the class. And so this is just a continuation of that as new barriers come up, that we're going to address each and every one so that the most amount of people are able to participate. And
That sound happens apparently when it reboots, so Ryan's trying to fix it so it doesn't interrupt it.
I was like, that's great. The owl agrees. And so we were just in a meeting today with a pharmacy, and we were talking with them about NC Care 360. And so hopefully through that conversation, they're going to join, so that because our partnership with them is an example of a partnership that's based on referrals from their patients, clients. And so that's a way that we would be able to document that relationship back and forth and to have that communication with them. But again, that's just a small picture, but we are talking about NC Care 360, and it's definitely something where more organizations are joining, and we're encouraging that. So next slide, please. And next slide, please. I think we still have more. And then Medicare DPP. So the Medicare Diabetes Prevention Program, that is by the end of next year. That's definitely something that it requires a lot of focus and a lot of dedication from finance, which we're all, in the COVID world, and we're also in our regular duties. And so this is definitely something that we need to put a little bit of a pause on so that we have more time to focus. But that is going to allow for the sustainability of MDPP, because we'll be able to bill Medicare for certain participants. So next slide, please. In Zoom, so we are well acquainted with Zoom. Our participants love Zoom. Rolanda loves to tell, who also is a part of our team, loves to tell a story of getting a person in their 90s acquainted with Zoom. So So it's working very well for all of our participants. We are more than welcome to assist them as they encounter obstacles, and they definitely help each other too. And so it's definitely allowing NDPP to continue until we can be in person. And next slide, please.
All right, awesome. So I'll do an overview for lifestyle medicine. We'll go to the next slide. So in good use data, improved health fashion, we'll be developing a clear impact scorecard, which is complete and should be live by the end of this fiscal year. We're also going to be collecting participant demographics. So our partnership with the community free track, but we're going to be looking at it internally as well. So excited about that continued partnership. We're also going to begin offering on a regular basis the Living Healthy with Chronic Disease workshop in Spanish. We have consistently done that in English, but based on that, and we'll also, based on our new capacity internally at Healthy Living, we hopefully should have a new Spanish bilingual member who would be able to assist us in meeting that particular need. So one of the big pieces of this particular grant is the food pharmacy being able to address food insecurity. So we will continue providing technical assistance to them in order to support that effort. And that has continued throughout COVID, and so we're proud of that. So based on the success that we've had with our partner at the Community Free Clinic, we would love to take lifestyle medicine internally. So we are now looking at different avenues for us to replicate something similar with obvious adaptations within our pediatric, women's health, and maybe even CD clinic. So that may possibly happen even before fiscal year 23. So for 5210, we are also the facilitating agent of that particular program. And right now we're going to support just the tracking of the goals. So based on our support of KCS, Superintendent, and CCS, we are going to be in all schools by 2025, and so we'll track our success via this scorecard, which should be live by the end of this fiscal year. And Culinary Innovations. I'll enjoy talking about food right around evening dinner time, right? So we're going to make sure we have a Culinary Innovation scorecard. Betty has worked with us to develop that, and once again, this should be live by the end of this fiscal year. Prior to, we did not have a tool that looked at demographics like age, race, ethnicity, but we have begun collecting that information, and that started at the beginning of this year, and we'll continue doing that. And those collected data will be implemented and showcased via that scorecard. So one of the particular gaps we had for our program is that we did not have a chef that spoke Spanish. Based on the support internally, we were able to contract with a Spanish bilingual chef. And so we have been recording different recipes and classes to be able to extend that service. And so that has been completed. And then we're also looking to further develop our video library, like that we like to call it, which is basically a collection of all of those videos. And we've been working with marketing to be able to publish those on YouTube. So it'll be very friendly. I think by now everyone is pretty acquainted with YouTube. So we'll continue to use that teaching tool. All right, so it's important for us to continue our partnership with our folks across the street at NC Research Campus. And thanks to support of Mark Spencer, we've been able to initiate the hiring of our Spanish-speaking chef. That's one of the examples that's come out of that partnership. And we recently received a grant that may also contribute to us doing those low-cost free classes. And so there'll be more on that. But the great thing is that all the videos currently have been at no cost. So that's awesome for the community. All right, so in order to expand beyond just cooking classes, we really want to look at food access. We're teaching people how to cook, but how do they get the food? So one of our goals in the next fiscal year is to partner with either internally our WIC department, our WIC program, or some other food access agency in order to assist them in basically publicizing how people can have access to food and how they can cook those particular items in a healthy way. Secondly, we'll also be looking at a food access policy. We're trying to move not just from direct service, but how can we really support on a policy level? And so in the next couple of years, we'll be evaluating how we can most appropriately do that. All right, and I think this is last one for Culinary Innovations, but if not, the main goal for this particular objective is to reconstruct our business plan for Culinary Innovations so we can begin reinvesting in the community. So how do we adopt a system that allows us to provide more low-cost free classes for individuals? And so we're working on that business plan. Oh, and then we'll be, we're already doing this, but based on some of the benefits of COVID, right, pushing us out of our limits, one of the things we've had to do is develop a live online cooking class, and we've been doing that in this year, starting in January. So if you're interested in joining our class, you can travel the world with us, and each month we go to a different country. All right, employee wellness. So we have a clear impact scorecard. Betty is helping us with that and her team. We are looking at establishing an assessment on what are we currently doing, what is the effectiveness of the services, as well as areas for us to improve. And one of the steps for that was to apply for a PMAP application for an associate to be with us, and that was submitted a couple of months ago. So hopefully we'll get that associate and we'll be able to move this forward. But even so, we were able to convene a task force, and that task force has already met. So we are on track to do this for 2022 deadline. Wonderful. Okay, so based on that assessment, what we want to do is be able to utilize that data to implement an enhanced work-site wellness program/policy. So we'll look at what's currently in place and make the necessary changes in order to support our staff in being well. All right. And then the other piece of this is once we learn from ourselves what happens internally, we really want to be able to offer this to our external partners. So the goal is to develop a framework that can be adopted by others, and hopefully that will be something that we'll be able to generate some income from, whether or not that's billable through insurance or some other means. And I'll hand it over to Anna.
You can scroll down to the next one. Thank you. So we will also continue to collect data and get that information into Clear Impact to kind of clean up that data. So, with this area, as far as improving health, we are going to look at reports generated through Crossroads, which is the North Carolina electronic management of WIC information. That's how we document all of our items for WIC families and issue benefits to them. So we are going to use the data from that to develop the quarterly tracking system for demographics of our participants, including race and ethnicity. We're also going to, by July 21, to generate a report from our breastfeeding peer counselors to de-aggregate the data on the participants they serve, to break that down by race and ethnicity as well, because that is outside of Crossroads. And so as far as the QList program is an online appointment booking system that we had in place for a little over a year. That was through a grant through Johns Hopkins and USDA, and that is coming to an end in May, or actually June, sorry. But on June 1, we are going to transition to a new online appointment system that will be a little more user-friendly for staff. So we're looking forward to that. We're on track for that to roll out June 1. All right. So by fiscal year 22, we would like to begin to utilize the NC Care 360. We already have staff that are trained with that, but just slowly tracking along with that system to be able to receive referrals and to make outgoing referrals to other agencies. All right, and so by May of this year, we'd like to ensure that we can continue remote WIC services Whether the federal waivers are in place for us to do that or not, we plan to continue to do some services over the phone as we are allowed with program regulations.
Are there any questions for us?
I've got a couple. On the diabetes, what's the, is there a target N size that you want to enroll? Are there criteria? And then when you get, is there some number you're trying to get enrolled in the program? And then on the building piece, do you think more half of our patients in the community, more than half have advantage plans? Do we think they're going to approve? I would think they would, but you never know. Have we looked into that on our Medicare population? Especially in this community, almost everybody is straight Medicare or the lower cost Medicare Advantage plans. I would consider relatively underinsured, no matter what their ethnicity is. Did you perform on this? There's some a lot of percentages, but like, what's the actual number of people that might get enrolled?
Yes, so in a typical year, it's 75 to 80. We currently have a little bit under 40 participants enrolled for this current fiscal year due to everything that's going on. But yes, it's.
So there's a cap on your maximum around 80?
Well, that's been feasibly with our staff and how many people typically enroll in a class, same day, same time. Able to exceed 80.
Okay, but it's a weird year being under-enrolled.
Yeah.
But once it opens back up again, so your target.
That's our target is 75.
Okay.
We're actually reaching out to some practices to try to get partnerships going, so we'd love to.
That's what I was thinking. I think there's a lot of people. You choose this rather than diabetes education atrium or something in the practice. It's maybe more convenient, depending on, it may not cost anything. It just seems like there's a big opportunity and it's hard to figure out how to get people. So that seems like you ought to be able to get 80 people to do this in the Medicare population at least, so you can at least find a way to build support the wraparound services, assuming that Medicare Advantage plans pay, which usually they pay for prevention.
There's Medicare,
It's straight Medicare. Well, straight Medicare will cover, it's the Advantage plans that they may or may not. Usually they tend not to pay for the expensive stuff at the hospital, and they're willing to pay for the prevention things because that decreases their costs, so that would be probably reasonable. And then I guess just a request, I always thought that Atrium had a lot of acronyms, but if you could ever make a list of all of these programs and databases and what they are and what they're collecting data for and who owns them, that would be helpful to me.
so you're clueless as to what.
You went through about 20 of these, and I, as a CMO, I do this all the time in lay populations. I get that glazed look of what the heck are you talking about? CLBSI and CAUTI and CDIF. And anyway, that would be helpful to me to understand what they all are, what they're related to, and what you're collecting data for, and what we get. Sounds like we get stuff back out of it, so it'd be interesting to know. Just a spreadsheet or something that says what the heck you are.
I think we have an acronym library already started, so if I need to pull that out, dust it off, and add to it.
So Alicia, when I listen to about your employee wellness, and I think about all the other governmental agencies that are in the county, Cabarrus County Schools, our school system, Kannapolis, City Kannapolis, Cabarrus County government, all the other entities. We struggle sometimes in HR with figuring out wellness. I can't imagine that any other group figures it out any better because that's not what we do. It's what you do. So I think figuring out how you, not you specifically, but you, CHA, get more, not necessarily better, or maybe better and more, or whatever that is involved with, you know, I'm sure Midland and Mount Pleasant, whose employees are just as important as any huge organization, would benefit from what you are trying to do within CHA. And so I think connecting with those folks makes a difference in how we are perceived and how we really work. And it's a bigger bang for the buck. Because if you've already got a wellness program that works for smoking, quitting smoking, or substance abuse of some sort, then we aren't out here looking for and necessarily paying for out of county a service that we could be paying for in county.
I'm so glad you brought that up, because that's actually something we're starting to explore, using the 3.0 model. How do we move from just doing employee wellness for ourselves? How do we take that to the next level and start to help all, focusing on small employers? Because big employers, they have staff and that, but how can we start working with smaller employers in the county to bring wellness in a structured, cohesive way across the county? So.
Great. So that leads me to my next point that I think this connects to. I wrote this, so when I was typing, I wasn't texting somebody else. We have built in the last 13 months an incredible network and incredible relationships with a lot of organizations that we never had a relationship with before, or had a relationship with that has been built to a bigger, better relationship. So, and I don't think ever before has the importance of public health been on everybody's mind. So you're sitting at a nexus of opportunity, in my opinion, to really stay in the forefront of what happens in Cabarrus County. Just be a model now, continue to be a model for how that relationship works, because we can't ever go back, or sometime in the future where we're going to have another pandemic, and consistent, reliable information coming from public health could, in my opinion, result in a better response. So when we lived this last 13 months, we were not as trusted as we are today, and we are not as knowledgeable as we are today. And we know that the public health guidance changes because science changes and research changes, and evidence changes. So relationships are hard to build and easily lost. The relationship that's being built with Barber Scotia College community and Reverend Anthony, we can't let that relationship wane just because COVID hopefully starts to wane significantly, and we basically are treating it like any other public health issue. So being able to keep those relationships going and being able to use the Barber Scotias, the El Puente, the school districts, the Midland government, and all those things, I think are going to be really important. And the reason I say this is, one, I got one more meeting, and two, is this seems to be, to me, because of the relationships we already have, a catalyst to get to the kids who are going to be the citizens in Cabarrus County down the road. And in your case, you're serving some of southern Rowan County because that's our school district. And so those kids' lives are changing because of the services they see from CHA, and it's just too important to not lose those relationships and even let it click back because we breathe. Because I know sometime soon, we're all going to take a breath and say, okay, this is done. We've overcome these. Now what? And instead of backing up and slowing down, keeping the pressure on, keeping the pedal to the metal, and keeping those relationships going are going to be really important to these issues and more. Sorry, I come off of my whatever podium, bench, stool, whatever it takes to get called.
Superintendent mode.
Yeah, whatever it is.
I want to pick up on that same theme.
Bonnie and I were in a meeting earlier this afternoon, and one of the things that we talked about is, we were talking about lifestyle medicine and a broader preventive approach. One of the things that we talked about is that when acute illness occurs, as with COVID, what it creates, exactly to your point, is a new relationship that is available to be extended and to bring in a broader concept of what health is. So I completely agree with you, Chip. We need to leverage those relationships that have been created through this health crisis to get folks on board with healthier ways of living. So I completely agree.
Any other comments or discussions? Okay, Alicia, we thank you and your team for your presentation today. Over here, sometime in the near future.
Thank you all.
You can tell Sue she's up.
No,
she's
she's
already up.
Hey, I'm back.
Okay, the next item will be the consent agenda, and Sue, yes, will be presenting the budget reviews.
So tonight, most of the budget revisions are aligning within the project. There are two budget revisions of note. The first one is environmental health. They're receiving $45,000 because they met their 100% goal last year from the state, and that's the state award to that program. And then Cabarrus County was, we're fortunate enough that they were able to continue to in our vaccine clinics. So we received $250,000 from Cabarrus County for those efforts. Are there any questions?
Okay. There are no questions. Could I get a motion to accept the consent agenda and the budget revision?
Chip, all in favor? All right, thank you very much. And I guess Sue, you're up again for finance policy.
Yes, this evening we are presenting 5 finance policies. They have no changes to the previous years. We make sure that the policies are in front of the board once a year. Does the board have any questions about the reserve policy, the eligibility policies for primary care, public health, or dental policy, or debt management policies?
No questions or discussions? Okay. May I get a motion to accept the financial policies review?
So moved.
Okay, may I get a second? Second. All right, all in favor? Aye. Thank you very much, Sue.
Aaron, I'm thinking you to the next meeting, we have your scrolling through these.
Get dizzy here in a minute.
That kid shirt in the back.
Welcome back.
Thank you. All right, so what I'm asking for is a change to the nepotism policy. So the current policy doesn't allow the hiring of certain immediate family members, but allows the hiring of other immediate family members. So my recommendation is the policy allows hiring as long as the relatives are not in their supervisor direct reporting chain. And if it's a leadership, also if there's a leadership person that may have a relative that wants to be hired, then the health director would have the final decision. CEO body would have the final, in this case, body would have the final decision-making authority on that.
So just so I'm clear, a director of health level position, let's go down 2 levels. So underneath that second level, there's a person that is a family member or somebody in the organization. They could be hired in that second level, into that second level of leadership or work, as long as they weren't supervised by the person who was above them in the family.
How I think of it is the, and thank you for the question, how I think of it is the direct chain of command. So, I report to Bonnie, for instance, so I wouldn't hire Bonnie's daughter.
Yes.
Because her daughter would still be in Bonnie. It is gonna be hard for Bonnie, that's a bad example. But that's a bad example. But let's say I reported to Aaron.
Exclusion apparently.
Right.
Which is.
But if I reported to Aaron, I wouldn't hire one of Aaron, and I would hire one of Aaron's kids, because they're still in that direct report.
But the person under you could hire Aaron's family because they report to them, not to you.
Still straight direct report.
How are you ever gonna hire anybody?
Well, Aaron, I'm not in Aaron's direct report chain, Aaron isn't in mine, so Aaron could hire one of my children, just for instance. So, she's not, we have no direct reporting relationship. So as long as they don't have any direct reporting relationship.
In the chain, yeah.
Yeah, the chain of command, any direct reporting relationship.
You guys obviously understand it better than I do, so I'm gonna go along with it.
Well, no, if you have.
No, I didn't want us to lose a good person, regardless of whether or not they're related to somebody, because they're the right person for the position. So I was trying to get to the level that they could be hired if you were reporting. If you're reporting to Aaron, at what level under you could you hire a person?
Well, yeah, like I said, that's not a bad question. That's a really good question, but my train of thought is, if anything could be affected by one of your relatives, a hiring decision, a firing decision, disciplinary action, I would tend to shy away from stuff like that, and you're more likely to be able to be influenced by somebody in your direct chain. Aaron is my supervisor. One of her children, she's still my supervisor. So if she says do X, Y, Z, whatever it is, I'm going to be inclined maybe to please my supervisor, or to do what my supervisor instructs me to do. So if you just take the person out of that chain of command, that's less. It could still happen in a roundabout way, but it's less likely to happen.
Yeah, I tend to agree with what you're saying. I'm not sure the language says that, which is where I think. So chain of command is as, I guess gets it down to what your HR structure is, but as supervisor structure is whatever, you have numbers or whatever for your position management. There's supervisors, directors, bigger companies have vice presidents and whatever. We're on that horizontal line as the supervisor, because ultimately everybody falls under body and chain of command. So, but I think that was the question over here, that if you have chain of command, ultimately everybody reports up.
Right, I don't say body was a bad example.
Right, but I mean, but what you're saying though is that it tees off at a lower level, not at body's level, the chain of command.
Yes, it does.
So I think we needed, that's what I was struggling with what chain of command means. It's not quite clear. What you're telling me is if there's two supervisors, this one over here can hire someone in this one's family because they don't have any HR decision-making process. They don't hire, fire, do annual assessments, decide on benefits, do anything.
Correct. That is correct.
Which I think is fine.
Yeah.
But I think it's just be careful, because if you ever got into a problem, the language has to support it.
I think what Steve said is I was the bad example. So Steve reports to me. So he could not hire my relative, but he could hire Aaron's relative.
Yes,
He doesn't.
I think the hang up is chain of command, because it goes above the person.
I agree completely. So this went through the CHA legal group. They're happy with the language? Then I'm gonna be happy.
Yeah, well, they gotta defend it if there's
That's right. If they're happy with the language, they gotta defend it if it happens, and
So I can tweak the language, I can also run it through the.
as long as the legal people are fine with this,
Your interpretations, but my interpretation with that language is what your interpretation is.
And I would say, if you look at that highlighted part, the way that, and the reason I highlighted it when I presented to leadership is because it doesn't even include all immediate relatives. So it's a weird policy to start with that needs tweaking in.
Different view of this. And it comes from my years in HR, in which in very large organizations, we struggled with this. And literally, we ended up, in at least 2 organizations that I worked for, defining it as divisions. But that was a big organization, and it was possible. The reason that we went that route was because, yes, you could hire Aaron's mother to work for you, but Aaron is in a position of significant influence that could cause the perception of her, we're going to say your mother, being treated in a disparate way from other employees. This is a small organization. The chances for that are greater than in a large organization. I would suggest that it may be necessary, and to Chip's point, I hate to ever exclude a good person from hiring, but I would look at some level in the organization and say that level's relations are not eligible to be hired.
We actually batted that around a little bit.
Because of the influence there.
Right, so just. Yeah, we batted that around, and that does make sense, it's the perception, so, my level and Aaron's level, probably the people that report directly to bonding probably are excluded.
Yeah.
It's back to what I was saying, at what level is the supervisor, manager, something lower, where, everyone always remembers the problem they had. It's always around perception, even if there's no influence, it's the perception. It's the causes of the problem.
Absolutely.
And honestly, the only reason I'm bringing it up is we deal with public policy and personnel all the time, and words matter.
Yeah.
And it's not that your legal team can't defend you and win, it's that your legal team has to defend you and win. And the cost of the legal side of that, and not just money, but in time spent, that can't be spent on something else, is huge. And so that was where I was coming from.
So do we want to table this?
I want to say one other thing, because I'm dealing with this today for quite a bit of time on another board that I'm on. I have a lot of faith in Eisenhower. I think he among the lawyers is a good one. And he actually writes English, believe it or not. But I will say that I have always taken the position that I draft, and the legal team says, okay, right, that's what they draft, and I can't figure out what the hell they're talking about.
I'm with you, that's the position I take.
So I guess what I hear Ryan saying is that we need to do some language manipulation here, and then bring this back.
Clearly, I don't mean to insinuate that. If the administration of this organization can live with the language that's there and it is defensible, I will vote right now tonight to approve this policy. I just wanted to make sure that the legal group had seen it, that they can defend it, will defend it, and that we can live with it, because I don't want to this community is too small.
Yes.
We don't have the 2 million, 4 million people in the community that we can sort from. And losing good people is always, or not losing them, but never getting them. Never getting the person. When that person goes to Rowan or Stanley or Iredale or Lincoln or Mecklenburg or somewhere else.
And I probably should have started with, that was the impetus for some of this, not just, it was, to me, a weird written policy,
Yes,
but
It
also
was weird.
some of those hard to fill positions, school, health, dental assistants. We are losing out on some of those folks because of some kind of weird relation.
If this makes it easier, roll on.
As legal look at, so,
I'm sorry.
is legal look at the language.
I have not sent it to legal, but I can and bring it back. I think the major change you guys wanted to make was, leadership is excluded from this policy, no relatives from leadership, period, and have legal take a second pair of eyes on it, and that makes perfect sense to me.
Yeah, I mean, my take on this again was just the language, which when I read it in advance, the question on what's the definition of chain of command, and then that supervisor with a capital S or a small s, that's the type of things. I mean, I work with and I've employed a lot of really smart, high people who can afford lawyers and not a lot of policies. When you have thousands of doctors working for you and if there's a problem, they can pick it to shreds. So it's the language that gets you hung up if you have a problem. That's just where I read this quickly and that's where I got hung up on. Okay, so what's chain of command mean? And, is the supervisor big S or small s? Does that define a specific position or is that just the one-up? I think you're defining that as the one-up person on your chain of command.
That is correct.
But
Yes.
people may say, no, that's a title of supervisor. And that's just my comments.
All right, I think that probably caught the suggestions, and I'll be sure to make those changes, and I'll bring it back to the board next meeting.
I do agree with the philosophy of the policy revisions, what you're trying to do.
All right, thank you.
Okay, our next agenda item will be the board's bylaw revisions. And I guess Bonnie kind of went through a little bit of why this came up. I guess as we were looking as far as the nominating committee, we have Mr. Kincaid that's going to be leaving the board in June. And Dr. Booker will also be retiring, so he will be leaving the board in June. Be able to look at, well, and then myself and Mark, we were actually, our appointments were actually ending at that time. So it had us to look at the bylaws as well as being able to fill the positions that we're going to be looking at. Well, when we started to look at the bylaws, the language, so as far as it was talking about county commissioners versus authority commissioners. So we asked our attorneys to actually look at the policy and look and do some revisions on that. So what you see, what you had the opportunity, we sent you guys the opportunity to look at the old policy versus the new policy with the revisions. We had to basically have that policy within your hands within 7 days of this board meeting, so we would have an opportunity to review that and discuss that. But again, are there any questions concerning the revisions that have been made to actually clear up the language that was in the policy? No questions.
My only question is when these two guys are no longer here, who are we gonna pick? We'll get to that. Oh, Steve is still here.
Yeah.
They involved.
Yeah, we have to move Dan up to this. But again, we do want to thank you guys for your service. And again, we're gonna be doing something a little bit further later on, I guess, as we get closer to the end of your term, okay? But again, may I get a motion to accept the bylaw revisions that have been presented to us by, excuse me? Oh,
I'll make a motion.
Okay, all right.
So moves.
Okay, second, all in favor? All right, thank you very much. And that moves us to the job that the nominating committee was presented with, which again was to look at, first of all, I want to talk about filling the position that Dr. Buckwell was going to be leaving, since it was not, his term was not over. And Dr. Buckwell did make a recommendation to us as far as Darrell Adams. The nominating committee, which was myself, Dr. Pons, Diane, and Dr. Coyle, had the opportunity to sit down and talk with Mr. Adams. And our recommendation from reviewing him and the credentials and the things that he brought, we felt like he would be a very good, I can't only use the word replacement, but he would be a very good person to fill the expired term that would be.
Replacement's just like.
That's what I'm saying. Yeah. So that, one of the recommendations that we wanted to make tonight for your approval was to have Darrell Adams to continue, and the term that was being left would be another year, that Dr. Buckwell would be actually, his term would be ending next year. And we did have the opportunity as far as Mr. Kincaid's position. We looked at 4 individuals. 2 of those were actually from the county commissioner's website. One of those was a recommendation from one of the board members here, and the other was a recommendation of someone that we basically had been familiar with out in the community. We had the opportunity to interview those 4 candidates, and at this point in time, we after reviewing those candidates, we'd like to make a recommendation to the board of Cecilia Perez as far as the candidate for the public position that will be available. And based on her background and the information that she presented, we felt like she was head and shoulders above, well, I won't say head and shoulders, but she was a very good candidate for what we were looking for. So we want to also present her to you guys tonight for your approval to be sent to the county commissioners. So at this point in time, I mean, if there are any questions about the process, or if there's any questions about any individual, we'd be more than happy to try to entertain those. But we wanted to at least make you aware that the nominating committee was putting forward those 2 names, Cecilia Perez and Darrell Adams, for the positions that were being vacated on the board. So at this point in time, I would, any discussion? If not, I would have a motion to accept the 2 candidates.
Motion to accept.
Can I get a second? Thank you very much. All in favor? Aye. Motion carries. Thank you very much, and we will, Diane will present. And then again, I do want to say this. I just want to thank Diane for all the work that she did as far as getting the resumes, calling the candidates, getting all of that set up, and making the job that we had as far as just to sit down and do the interview a whole lot easier than it would be. But I want to thank Diane for all the hard work she did towards pulling that together for us and make it a lot easier. And I would say going forward, the process that we now have as far as when we have to look at other candidates, there's a process in place that we can follow. And I think that would be very helpful as far as whoever we look at for the next candidates in the next 3 years that would be coming up, because I know my term will be over at that point in time. Okay.
Mr. Mack, I just want to say all the candidates that we talked to were great, and we were just really impressed with everybody. It was really hard decision, but we felt like the nominees we got forward were what we needed at this time. So, and Mr. Mack does this amazing thing every time, so he was great in the process. So thank you.
Again, I want to thank Dr. Cohort because she led the process. So again, she made it very easy for us in leading the process as far as bringing the candidates forward, introducing those, and she did most of she presented the questions that we had and gave us an opportunity. So again, the process worked very well. So anybody interested in the nominating committee and what we do at some point in time, you're welcome to come and welcome to sit in as more of that.
I have one question. Do we have, the folks that you interviewed, would you consider them a pool so that if we have other vacancies, or do we go through that process each time, or
Yeah, we are impressed by, we are going to be asking them to sit on other committees, we're connecting them with community advisory boards that we think would be their expertise in
Well,
the area.
that's a very good thing.
Without bringing in, and, right, so that we can get, we can work with them even more, and then they may be, again, a candidate we would consider the next time doing.
Excellent.
Because at this point in time, we haven't made anyone other than Cecilia aware of the decision that had to be presented to the board. So since we've got your approval, we can actually go back and sit down and talk with the other candidates to see if they would be interested in some of the committees that would be looking at moving forward. And that would give them the experience that they would need and give the board the opportunity to see their capabilities for any slots that would be coming available in the future.
And I'm perfectly comfortable with the decision the committee's made. But do we have a little background information on Cecilia so we know a little something about her when she arrives?
Yes, so she, it works for Duke over right across the street in their research area, and her job there is trying to recruit diverse individuals to the research projects that they do. She is very involved with El Puente, who is one of our very important partners in a lot of the work that we are engaged with, and came in the high recommendation of one of our staff as someone who can really bring a lot of passion and excitement for working with vulnerable populations, particularly the Hispanic population. And because of her knowledge and understanding of how to engage individuals, I think it's just a critically important role both on our board and for our staff to learn from as we try to, right now, as we're trying to increase the percent of our vulnerable populations that are vaccinated, and that we can really learn a lot and gain from her expertise in those areas.
It sounds like there are 2 or 3 good connections there with the research campus and the other things.
She worked for the school system for many years,
Yes.
English language. Right, so she's been an educator, a teacher, and she's been on several boards, so she has that experience of working with them.
Excellent.
Board experience, very connected in the community, so that was very good. Outstanding things that we saw. Okay. All right, we'll move to our next agenda item, which will be informal public comments, anyone from the floor. So, all right, if nothing there, then again, any announcements? I did not have any other than we make you aware that the 2 gentlemen, I think we talked about this at the last meeting, 2 gentlemen that would be leaving the board in June. Any other announcements? I don't know if you had anything as far as any additional announcements. Okay. If not, we need a motion to adjourn. May I get a motion to adjourn our meeting?
So moved.
May I get a second? Okay, we have a first and a second. All in favor? Aye. Again, thank you, gentlemen.